Hello, I'm Dr. David Oster. Welcome to Oster Oncology. We're here to help you, cancer patients, fight stronger and fight smarter. We use natural integrative medicine in conjunction with your conventional treatments, again, to get better outcome and tolerance through your treatments. It is the month of November. It is Movember, and it is Prostate Cancer Awareness Month. So this video I'm putting out for you guys. I'm going to give you a bit of an overview of your diagnosis and the treatments that come just quickly, and then the side effects. Stay to the end. I've got a couple just clinical pearls to give you on how to tolerate the common side effects that we see from things like surgery, radiation. And so if you're dealing with a new diagnosis, then stick around and listen to all this. A lot of it hopefully is going to be helpful for you. And then if you've already walked through treatment or you're in the midst of it, if you need some help, we're here for you. So again, the month of November is going to be something where we are going to be putting out a series of videos for you gentlemen for specifically educating, increasing your awareness and understanding of your case and the options you have to in regards to the integrative piece that you can bring in safely into your conventional treatments. So stick around for those throughout this month. We'll get them out to you. We're going to be looking at more specifics on the pathology, more specifics on treatment, and again, hopefully teasing out all the really important pieces that you need to get a handle on that can just help you understand your case more. Okay? All right. So today we are going to be talking, again, just talking generally about the initial diagnosis and then leading into treatments. The numbers generally, outcome numbers for prostate cancer are really good, guys. So we wanted this video to be an encouragement to you. The majority of biopsy proven prostate cancer, the majority, 80%, these gentlemen find themselves in this realm of low risk disease, Gleason 6. I'll talk to you a little bit about Gleason today. Again, we're going to have another video about Gleason scores and what that means to your treatment. But Gleason 6 is low risk. The majority of those men do not need any treatment at all. So they go on active surveillance where your PSA is watched repeatedly over the years to make sure things are staying okay and staying low for you. So again, 80% of you gentlemen with your biopsies where you get prostate cancer in the diagnosis, 80% can be told, hey, we can watch this. Watching brings about the same results as if we went after it with radiation or surgery. Okay, so that's good. The remaining 20% of you men, you may find yourself with a higher score, Gleason score of a Gleason 7. Definitely if you find yourself with a Gleason 8, 9, or even 10, then you're going to be recommended treatment. Now a Gleason score, just briefly, speaks of how aggressive, when they remove that biopsy and they look at the cells, how angry do they look? What is the likelihood that they are aggressive and they may have developed some survival skills, these cells, that they may be a risk to become metastatic down the road. And if that's the case, with the Gleason 8 to 10, definitely you need treatment, and definitely with the Gleason 7 too, you're going to be offered treatment. So the numbers, even if you find yourself, gentlemen, in that range where you've got a higher Gleason score, you're being recommended treatment, the long-range success, again, an encouragement to you, 20-year overall survival, 20 years, not 5 years, which often cancer is assessed by 5-year survival rates. In prostate cancer, we're looking far further down the road. 20-year survival rates, they're in the 70% range. Okay, so these are really good numbers for you guys. So even though you may have to walk through treatment, I just want to encourage you. It's really worth it, and the numbers look good down the road as well. Okay, treatments. So the common two, of course, are surgery and radiation. Surgery is often given in cases where the tumor seems to be involving the outer capsule of the prostate. So if the tumor is located deep within the prostate, then that's good. If it seems to be abutting or engaging the side wall of the prostate and maybe even invading into the side wall of the prostate, then surgery is often elected. It can be an open surgery, it can be robotic surgery. It seems to have very similar results to radiation, again, in these early stage localized prostate cancer cases. The side effects can be quite similar to the radiation as well, where we can have issues with erectile function and urinary function. These are the two main systems of the body. Everything is so tightly packed in the pelvis, right? So the bladder is there, the prostate is there, the colon is there, the rectum is there. And so everything's so tightly packed that even with the very precise treatments that you can have right now, surgery, and then we'll talk about radiation quickly here, even though they are very precise, everything is knitted together so tightly in the pelvis that we can still have some collateral damage to urinary and erectile function. Okay, radiation, a historical use of radiation has always been external beam radiation, where you can picture the radiation being shot at the prostate. It can get far more precise than the way I just described it now. There's Tomo, there's Calypso, so there's different technologies where the radiation externally can be applied in a very precise manner, which is great, but there's also an increase in the use of brachytherapy. And brachytherapy is the catheter-fed, catheter-delivered, so catheters are inserted into the prostate and radioactive pellets are then delivered directly to the tumor site. And they're being used very effectively. There are two forms of it. There's a low dose rate radiation brachytherapy, and there's high dose rate radiation brachytherapy. And the high dose rate is the radiation pellets are delivered to the site of the disease on the day of your treatment, and then they are removed, so they are not permanently placed. The low dose rate, you gentlemen that are going through that, you get to keep those ones. So those pellets are permanently implanted in the prostate. They're yours for life, and they emit a lower potency of radiation over a longer period of time. But both therapies look similar with the radiation being delivered through these catheters. The benefit of this brachytherapy that's being used more often now is that it seems to have a decreased complication with the rectum. So often with external beam radiation, we can have the rectum, which comes very close to the bladder and the prostate, can be involved. We can have proctitis, we can have mucus production, inflammation, diarrhea can be a complication, and we see this far less with the brachytherapies. And the brachytherapies also seem to benefit long-term compared to external beam when we are looking at something called biochemical failure. And you can look into that, but essentially it's after you receive definitive treatment, do we see the PSA starting to rise over time? Of course, that'll be measured and followed in your case. And if that is the case, how often does it occur? And when we see with what we see with brachytherapy is that this rate of reawakening of the PSA coming up, we see this happen less with the brachytherapy. So there's another benefit to that as well. So with both radiation and surgery, we do see again a similar complication, residual side effect profile where we have erectile function as a possibility, urinary function as a possibility, and again sometimes some rectal involvement. That is more of a temporary issue though. And again, we can use some amazing natural compounds to really clear that up for you as well. Another class of treatment for some of you gentlemen is anti-androgen or anti-testosterone therapies. They are commonly used as well. They decrease testosterone, of course, with prostate cancer. It is a hormone-dependent cancer, so these anti-androgen therapies, they are either injected or they're taken orally, and they can decrease testosterone over time. The side effects of those, here you go again, erectile function, vitality and strength, libido can be dropped as well. We can get hot flashes with them. And again, with all of the gentlemen in my practice, we walk you through all of this as well, okay, with natural compounds. So for those of you that are dealing with a metastatic case, again, another class of therapy that you will likely be looking at is more of a systemic therapy or a whole body therapy, which is chemotherapy. The number one chemotherapy that is used is Taxotere or docetaxel. The side effects of that can be low blood counts, white blood cell counts dropping, hair loss, your fingernails can be affected as well. We can get some neuropathy, some fatigue, maybe some digestive issues. And so with all of the gentlemen walking through this type of chemotherapy, again, there's so many natural compounds that we use on a daily basis here to keep you stronger than what is typically seen on men that are just conventionally supported, okay? So with the treatment of all of these, again, erectile dysfunction, I wanted to circle back to that one because I promised you I would give you a couple tips at the end of the video here. One of the key great little hacks that has such a great clinical response, we see really good effect with it with erectile dysfunction, is a little amino acid called L-arginine. You have to deliver it at a pretty good dose. It's definitely workable. You can do it, but you need to hit a certain milligram dose. And what L-arginine is, it's a vasodilator. So it dilates the blood vessels that are bringing blood to the shaft of the penis, and of course essential for erectile function. So it helps men achieve erection and maintain erection as well. And so L-arginine can just be a simple thing you add, and we've seen so many men get just functional results. Of course, we need a functional result here. And so it's an option for you in addition to things like pumps. Of course, there's medications that you can use for erectile function, and then there's some implants as well. But a very nice, simple, and often very effective all on its own is this L-arginine. There are some herbs that you can use as well. There's a couple herbs that we use to increase vitality, libido, aphrodisiacs, and we've seen erectile function. I've seen erectile function improve with my guys in that regard as well. So, gentlemen, the video today, we're going to be coming back with some other videos that dive into a couple key aspects in a little bit more detail for you through the month, so keep an eye out for those. But today we just wanted to encourage you with really good numbers, a bit of an overview of your treatment options, common side effects, and again, a couple examples, but certainly there are more options in regards to integrative medicine being brought into your case just to help you tolerate these treatments better and bounce back to your normal self after these treatments. And so from all of us at Oster Oncology, it is Movember, it is November, Prostate Cancer Awareness Month. We are here, gentlemen, to help you fight stronger and fight smarter. If you want to share this video, if you're seeing this on Facebook, please share it. If you're visiting the website, contact us there, the number's there. And then, of course, on YouTube, if you're seeing this on YouTube, then subscribe to our channel because we're going to keep coming with these videos for you. Again, our goal here is to just give you this knowledge from the world of clinical oncology, but then also this complementary integrative piece to help you fight stronger and fight smarter.